If you're over 60 and you went to bed last night without enough magnesium in your body, you may have spent the entire night putting your heart under stress without even knowing it. I know that sounds extreme, but I need you to stay with me because what I'm about to share with you is something almost no doctor is screening for, almost no doctor is talking about, and almost no doctor is connecting to the people they're losing in the middle of the night. My name is Dr. Morgan, and I've been working with cardiac patients for nearly 20 years. And in those 20 years, I've watched a pattern emerge that nobody's really addressing. People come to me with heart palpitations, heart flutter, irregular heartbeats, muscle cramps that won't go away, restless legs at night, difficulty sleeping, weakness and fatigue that doesn't make sense. And when I run the standard test, everything comes back looking fine. Their cholesterol is okay, their blood pressure is controlled, their EKG looks normal, but they're still suffering. They're still having symptoms, and in most cases, the answer is sitting right in front of us. It's magnesium deficiency. Nearly 80% of adults over 60 are not getting enough magnesium. 80%. And almost all of them have no idea that's why they're experiencing the symptoms they're experiencing. They're not losing their mind. They're not having a cardiac crisis that nobody can find. They're just magnesium deficient. And magnesium deficiency, especially at night while you're sleeping, is one of the most dangerous conditions I see in older adults because it directly attacks the one organ that keeps you alive. Let me tell you about a man named Henry. He was 64 years old, a retired accountant, healthy weight, no history of heart disease, but for the past year he'd been experiencing the most frustrating symptoms. His heart would flutter, not constantly but randomly, especially at night. He'd be lying in bed trying to sleep and suddenly he'd feel his heart skip or race. It was terrifying. He'd been to 3 different cardiologists. They'd all done EKGs. They'd all done stress tests. They'd all done blood work. And everybody said the same thing. Henry, your heart looks fine. There's nothing wrong. But something was clearly wrong because Henry could feel it. His wife could hear him sometimes lying awake at night, feeling his pulse, trying to figure out what was happening to his body. He was convinced he was having cardiac events that the tests just weren't catching. So he went to a 4th cardiologist. This one, thankfully, asked a different question. He didn't just do the standard cardiac workup. He asked Henry about his diet, about his symptoms, about when the palpitations happened. Henry mentioned that the episodes were worse on nights when he'd been more stressed or when he hadn't slept well. The cardiologist asked, "Have you ever been tested for magnesium levels?" Henry said no. Nobody had ever mentioned it. The cardiologist ran a magnesium test. Henry's levels came back at the very bottom of normal. It's technically not deficient according to standard ranges, but functionally deficient. The cardiologist said, "I think this is your problem." Henry was skeptical. He said, "How can magnesium cause my heart to flutter?" The cardiologist explained something that changed everything for Henry. Magnesium is the 4th most abundant mineral in your body. After your heart starts beating before you're even born, magnesium is what allows your heart muscle to relax between beats. Without enough magnesium, your heart can't relax properly. It becomes irritable. It starts misfiring. It starts having arrhythmias. And at night, when you're lying still and your heart is supposed to be calm, that's when the problem becomes most apparent. The cardiologist recommended Henry take a magnesium supplement, a specific form called magnesium glycinate. Not the cheapest magnesium, but one that actually absorbs well in older adults. Henry started taking it. Within a week, his heart palpitations had decreased by half. Within 3 weeks, they were almost completely gone. Within 2 months, he felt like a different person. He told me, "I spent a year convinced I was going to die of a heart attack. Convinced there was something wrong with my heart that nobody could find, and it was just magnesium." This is the story I see repeated over and over. People suffering from symptoms that are directly caused by magnesium deficiency, but nobody's looking for it because it's not taught in the standard medical curriculum the way it should be. Doctors are trained to look for the big dramatic things: high cholesterol, high blood pressure, arrhythmias that show up on an EKG. But magnesium deficiency is silent. It's invisible on standard tests. It's sneaky. And it's incredibly common. Here's what happens to your body after 60. Your gut absorption changes. Your stomach acid decreases. That acid is necessary to break down magnesium from food. So even if you're eating foods with magnesium, you might not be absorbing it. Additionally, if you're on medications for acid reflux, which most older adults are, that's making the problem worse. Those medications reduce stomach acid even further, which means even less magnesium absorption. You're also more likely to have diabetes or pre-diabetes after 60. High blood sugar causes your kidneys to excrete magnesium in your urine. You're losing it. If you're on a diuretic for blood pressure, which is very common, that medication is also making kidneys excrete magnesium. You're losing it faster than you're taking it in. And if you're stressed, which most people are, stress depletes magnesium. Your body uses magnesium to manage the stress response. So the more stressed you are, the more magnesium you burn through. By the time you're 60 or 70, most people have been slowly becoming magnesium deficient for years without even knowing it. Now here's where it gets dangerous, and this is critical to understand. Magnesium is responsible for hundreds of functions in your body. But the function that matters most, especially at night, is regulating your heartbeat. Your heart is a muscle. It has to contract and then relax. Contract and relax, over and over. Hundreds of thousands of times every single day. That relaxation phase is controlled by magnesium. Without enough magnesium, the relaxation phase doesn't happen properly. If the heart muscle stays partially contracted, it becomes irritable. Irritable heart muscle means arrhythmias, irregular heartbeats, palpitations. And here's the terrifying part. Many of these arrhythmias don't show up on a single EKG. You have to catch them while they're happening. So you can have significant arrhythmia problems and still pass all your cardiac tests. This is why people go to the cardiologist, pass all the tests, get sent home, and then have a cardiac event in the middle of the night. Not because the tests were wrong, but because the arrhythmia wasn't happening at the moment the test was being done, but it's happening at night. It's happening when they're stressed. It's happening when they haven't slept well. It's happening when they're magnesium deficient. Additionally, magnesium affects something called heart rate variability. This is a measure of how much your heart rate varies between beats. Sounds technical, but it's actually incredibly important. Higher heart rate variability is good. It means your nervous system is balanced. Low heart rate variability is bad. It means your nervous system is stuck in stress mode. It's a predictor of sudden cardiac death. People with low heart rate variability are at higher risk of dying suddenly from a cardiac event. Guess what depletes heart rate variability? Magnesium deficiency. So people who are deficient in magnesium are literally at higher risk of sudden death. And nobody's screening for it. Nobody's telling them. I had another patient named Margaret. She was 72 years old. She'd been having restless legs at night. She couldn't sleep. She'd lie in bed and her legs would twitch and jump. It was driving her and her husband crazy. She'd been to a neurologist about it. The neurologist had suggested a medication for restless leg syndrome. But Margaret wanted to know why it was happening. She came to see me and I asked about her symptoms. When did it start? How severe is it? What makes it better or worse? She said it was worse when she was stressed or when she hadn't been sleeping well. And I asked, have you ever been tested for magnesium? She said, no. I ran a test. Her magnesium was low. I recommended she supplement. She was skeptical because she didn't think magnesium had anything to do with her legs twitching. But she tried it anyway. Within 2 weeks, her restless legs had improved dramatically. Within a month, they were almost completely gone. She was sleeping through the night for the first time in years. She told me, I can't believe the answer was something so simple that nobody ever suggested to me. This is what frustrates me most about modern medicine. We have all these tools, we have all this technology, but we're not looking at the fundamentals. We're not looking at basic nutritional deficiencies that can cause serious symptoms. We're looking for disease, we're looking for pathology, we're looking for things that fit into our diagnostic categories. But magnesium deficiency doesn't fit into a nice diagnostic category. There's no disease called magnesium deficiency syndrome that gets a billing code. So it gets overlooked. But the symptoms are real, the dangers are real. And the solution is simple. Now, here's what I need you to understand about magnesium and sleep, because this is where the real danger happens. You're 60 or 70 or 80 years old. You go to bed at night. Your nervous system is supposed to shift into parasympathetic mode. This is your rest and digest mode. Your heart rate is supposed to drop. Your blood pressure is supposed to drop. Your muscles are supposed to relax. Your breathing is supposed to slow. This is supposed to be the most protective time for your heart. But if you're magnesium deficient, none of that happens properly. Your nervous system can't shift into rest mode because magnesium is what allows that shift to happen. So you lie in bed and your heart rate stays elevated. Your blood pressure stays high. Your muscles stay tense, your breathing stays fast, you might be lying perfectly still, but your body is in a state of sympathetic activation, fight or flight mode, at night when you're supposed to be resting. What that does over the course of 8 hours is put tremendous stress on your cardiovascular system. Your heart is working harder, your blood pressure is elevated, your vessels are constricted. And if you're already dealing with any degree of arterial disease, if you've got any plaque buildup, that extra stress can cause that plaque to rupture. That can cause a blood clot to form. That can cause a heart attack in the middle of the night while you're sleeping. And you never saw it coming because the EKG you got at your doctor's office last month looked fine. Additionally, magnesium is a natural anticoagulant. It helps prevent blood clots. Without enough magnesium, your blood becomes more prone to clotting. Add that to the other risk factors and you've created the perfect storm for a nighttime cardiac event. This is why magnesium deficiency is so dangerous. It's not just causing uncomfortable symptoms like palpitations or restless legs, it's actually putting you at increased risk of a serious cardiac event, and almost nobody is screening for it. Let me tell you about another patient. Thomas. He was 68 years old, no history of heart disease, healthy diet, exercised regularly, but he'd been having increasing muscle cramps, especially at night. His legs would cramp, his feet would cramp. He'd wake up in the middle of the night with a Charlie horse in his calf. It was miserable. He went to his doctor about it. The doctor suggested it was just dehydration and recommended he drink more water. Thomas did. Nothing changed. The cramps got worse. He went back to his doctor. This time the doctor suggested it might be a potassium deficiency and recommended a potassium supplement. Thomas took it. Nothing changed. He was frustrated. He felt like nobody could help him. Then he came to see me. I asked about his symptoms. When did they start? Was there anything that seemed to trigger them? He said they were worse on nights when he hadn't slept well or when he'd had a stressful day. I said, "Has anyone tested you for magnesium?" He said no. I tested him. His magnesium was significantly low. I recommended magnesium supplementation, specifically magnesium glycinate, 300 milligrams before bed. Within 1 week, his cramps had improved. Within 2 weeks, they were almost completely gone. He was sleeping through the night without being woken by painful muscle cramps. He told me, "I wasted months trying to figure this out. Went to my doctor multiple times, and the answer was just magnesium. And nobody suggested it." This is happening to hundreds of thousands of people right now. They're having symptoms, they're going to doctors, they're getting tested, everything under the sun. Nobody's checking magnesium. And magnesium deficiency is so common after 60 that it should be one of the first things checked when someone comes in with certain symptoms. But it's not. It's not taught as a priority in medical school. It's not emphasized in continuing education for doctors. It's not on the standard battery of tests most doctors order. So people suffer and they think something is seriously wrong and they live in fear when actually they just need more magnesium. So here's what you need to do, and I want you to do this soon. First, pay attention to your symptoms. Are you having heart palpitations, muscle cramps, restless legs, insomnia, muscle weakness, fatigue, anxiety, or mood changes? If you're experiencing any of these, magnesium deficiency is worth exploring. Second, ask your doctor to test your magnesium level. Specifically ask for a serum magnesium test and, if possible, an RBC magnesium test, which is more accurate. Don't just accept it if your doctor says your level is in the normal range. Normal range on paper doesn't always mean you're getting enough to prevent symptoms. Ask your doctor what your specific number is. If it's below 12 or so, I'd consider it deficient, even if the lab says normal. Third, look at your diet. Are you eating magnesium-rich foods? Leafy green vegetables are the best source, but you need to be eating a lot of them. Pumpkin seeds, almonds, spinach, kale, chard. Are you eating these every single day? If not, you might be missing out on dietary sources of magnesium. Fourth, consider supplementation. If your doctor agrees, magnesium glycinate is generally considered the best form for older adults because it absorbs well and doesn't cause digestive upset the way some other forms do. The dose usually ranges from 200 to 400 milligrams per day. Take it with food. And take it in the day, not in the morning, because magnesium can help you sleep. Fifth, be aware of things that deplete magnesium. Stress depletes it. So if you're under a lot of stress, your magnesium needs go up. Alcohol depletes it. Caffeine depletes it. Sugar depletes it. So if you're drinking a lot of coffee or consuming a lot of sugar, you might need more magnesium to compensate. Sixth, if you're on medications that deplete magnesium, like diuretics or acid reflux medications, Talk to your doctor about whether supplementation makes sense for you. Now, I want to be clear about something. I'm not saying that magnesium deficiency is the cause of every heart problem. Some people have genuine cardiac disease that needs proper medical treatment. But I am saying that magnesium deficiency is far more common than most doctors recognize, and it's causing real symptoms and it's putting people at risk. And before you accept a diagnosis of an unexplained cardiac arrhythmia, or before you take a medication for a symptom that might be caused by simple magnesium deficiency, it's worth having this conversation with your doctor. It's worth getting tested. Because if it is magnesium, the solution is incredibly simple and incredibly safe. You just need to get more magnesium. I had a patient named Robert who came to me after his wife practically forced him to get a second opinion. He'd been having palpitations for years. He'd been to multiple cardiologists. They'd all done the standard workup. Everything looked fine. He was at the point where he'd almost accepted that he was just going to have this problem for the rest of his life. He'd been told by one cardiologist that it was anxiety causing the palpitations, so he'd been put on an anti-anxiety medication. That medication had its own side effects. He felt foggy and tired all the time, but he was still having palpitations. His wife said, "There has to be another answer." That's why he came to see me. I ran the magnesium test. He was significantly deficient. I recommended magnesium supplementation. He was skeptical because, like most people, he didn't think a simple mineral could be causing his cardiac symptoms, but he was desperate. He tried it. Within 3 weeks, his palpitations had decreased dramatically. Within 2 months, they were almost completely gone, and he was able to stop the anti-anxiety medication because he didn't need it anymore. The palpitations were gone. He felt like himself again. He told me, "I can't believe I spent years dealing with this when the answer was just magnesiums." Here's what I want you to take away from everything I've shared today. If you're over 60 and you're having symptoms that don't quite fit into a clear diagnosis, if you're having things like palpitations or muscle cramps or restless legs or insomnia or unexplained fatigue, magnesium deficiency is absolutely worth exploring. It's incredibly common. It's almost never tested for, and it's very treatable. You don't need a complicated medication. You don't need surgery. You don't need anything dramatic. You just need to get your magnesium levels up. And in many cases, your symptoms will resolve. Your sleep will improve. Your heart will calm down. Your muscles will stop cramping. You'll feel like yourself again. Additionally, even if you don't have obvious symptoms, if you're over 60, it's worth considering magnesium supplementation as a preventive measure. The research is very clear that magnesium deficiency is associated with increased risk of sudden cardiac death, increased risk of arrhythmias, increased risk of high blood pressure. Taking magnesium as a preventive measure could literally save your life. It's inexpensive, it's safe. The side effect profile is minimal. The worst that usually happens is some mild digestive upset if you take too much. And that's easily avoided by using the right form of magnesium and not taking too high a dose. So this is something worth discussing with your doctor. This is something worth exploring. I also want you to think about people you know who are experiencing symptoms that might be related to magnesium deficiency. A family member who's having heart palpitations. A friend who's dealing with insomnia. Someone who's having muscle cramps. You might be able to help them by sharing this information. You might be the person who suggests getting magnesium tested. You might be the person who points them toward a solution they've been searching for. And that could genuinely change their life. It could prevent a serious health event. It could restore their quality of life. It could give them back years of better sleep and better health. So here's my challenge to you. If anything I've talked about today resonated with you, if you recognized yourself in any of these stories, take action. Call your doctor. Ask to be tested for magnesium. Ask what your specific level is. If it's low, ask about supplementation. Talk to your doctor about the best form and the best dose for your situation. Give it a real trial. Most people need at least 3 weeks to see improvement in symptoms, so don't give up after a week. Give it time. Your body needs time to replenish its magnesium stores. But if you stick with it, there's a very real chance you're going to feel dramatically better. And if you don't have obvious symptoms right now, but you're over 60 and you want to protect your heart and improve your sleep and just generally feel better, ask your doctor about magnesium supplementation as a preventive measure. This is not a cure-all. But for a lot of people, especially older adults, transformative. It's one of those simple interventions that can have a huge impact on quality of life and potentially on longevity and cardiac health. Your heart has been beating for you for decades. It's been working faithfully every single day and every single night. Give it the support it needs. Make sure you have enough magnesium. It could be one of the most important things you do for your health. Thank you for watching. Please share this with someone you care about. You might be helping them find an answer they've been searching for.